We are graduate unemployed nurses and midwives who have stayed in the house for more than 4 to 5 years now. We wish to vehemently register our displeasure against the government and its agencies, Ministry of Health and Ministry of Finance, over their neglect to offer financial clearance and permanent employment to over 75,000 graduate nurses and midwives, trained from various accredited public universities and training colleges, after successfully passing their Nursing and Midwifery Council licensing exams. We wish to remind the government of the backlog of the 2020, 2021, and 2022 nurses and midwives who are awaiting their postings to render their services to our country, to prevent continuous skills decay day by day, and also acquire more knowledge in the profession, since nursing and midwifery practice is a continuous process that needs constant knowledge upgrades in the field. Qualified trained nurses and midwives are unposted and jobless, whilst government and its agencies have ignored these professionals for unqualified hands, such as senior high school graduates, to undertake little training to practice in the ward. Have the qualified graduate nurses and midwives committed any crime against the government or their employers? We've been trained for 2 years, 3 years, 4 years, national service 1 full year in addition, making it 5 years, 4 years, and 3 years. And yet we are unemployed in the house. But someone who has gone to senior high school, read business, science, any other thing, is going to be given training for just 3 months. How is this person going to learn what we have learned for 3 to 4 years to come and take care of the common Ghanaian who is not feeling well? We are using this platform to call on stakeholders and all Ghanaians to support the Ministry of Health and Ministry of Finance to immediately release clearance and subsequently employ this group of nurses and midwives permanently. Reports from our Mother Association says over 1,500 staff nurses and midwives have traveled outside the country, leaving vacancies in various hospitals, thereby exposing the few staff to work overload. Coming forward, we have ghost officials. We are graduate nurses and midwives, unemployed. We are in the house with our mates. We are expecting the government to give everyone, each and everyone who has undergone the training in colleges, universities, the same opportunity or equal opportunity to enable us all practice in the world. But here is the case that we have some of our colleagues, our classmates, that we have sat with them in the same exam hall to take an exam, working in the ward, and we are at home. When you ask a question, they tell you, with these special postings, from who? We want to know that answer. Who is the official, or who are the officials giving these people the opportunity, leaving others behind? Though they are not the majority, but we can say that, not certain, but we can say that we have over 2,000 of our mates, both 2020, 2021, and 2022, working in the wards. Rumors has it that there are some workers of Ministry of Health and Ministry of Finance who are taking not less than 5,000 Ghana cedis to offer financial clearance and permanent postings to some unposted nurses and midwives, of which we are currently having some of our mates in the ward posted. Just as I mentioned before, not just 5,000 Ghana cedis. I received a text message, a screenshot of a text message that said someone is charging up to 17,000 Ghana cedis just for a portal, financial clearance portal, and Ministry of Health postings. In the sense that when we talk about financial clearance and postings, Ministry of Finance will give a statement or a go-ahead, a note, an authority note to Ministry of Health saying, post this number of nurses. We will be able to pay them. The Ministry of Health will go ahead to post. So if somebody is saying, I am charging 17,000 for clearance and postings, it means we have these ghost officials in both agencies linking up, enriching themselves at the expense of our suffering. We have gone to nursing training, paid huge amounts of fees, expenses that we have inquired is nothing to talk about. Then we have people seated somewhere asking for money, 17,000 Ghana cedis, to give me my employment. How many years am I going to work as a common nurse to accumulate that amount after I have been posted? It's a question to the ghost officials. We are here. Somebody might ask, what have we done since we have graduated from college? 2020 badge from the training college. We have been in the house for 3 years and this is the 4th year. 2020 badge, university trained nurses and midwives. They have been in the house for equally the same years. Those who have done health assistant preventive and health assistant clinicals, who completed 2020, have been in the house for 4 years. Regardless of all this period, we haven't sat down doing nothing. We have made several visits to Ministry of Health and Ministry of Finance to negotiate with the authorities about this process. Leaders of the above-mentioned association have visited both Ministry of Finance and Ministry of Health on countless occasions, but to no avail. No proper feedback has been given or received from the agencies. It has always been reassurances upon reassurances, and even with occasions when some of the members of the unemployed group went to Ministry of Health, did not receive any good reception or any positive response, just asking for little information. Can you kindly tell me where have my employment status gotten to? No response, and we have to wait. We had to wait and wait and wait, but to no avail. We are by this press conference making it known to the government, Ministry of Health, Ministry of Finance. The delay of our unemployment has had negative impacts on all the graduate nurses and midwives, especially the 2020 batch. Some nurses were trained for 2 years and have stayed home for 4 years without practicing. Their knowledge acquired during training is deteriorating and becoming archaic because there are new things that World Health Organization is introducing into the world. For instance, we have midwifery. In midwifery currently, we have something called labor care guide, which is very necessary for the midwives to start learning it. It's a complex guide, not so complex, but it needs more time and practice to get that knowledge. Nursing and midwifery is a noble profession which should not have their members on the streets engaged in all kinds of activities such as trosky or churchill mates, galamsey, concrete works, selling of pure water, etc. Some of these graduates have died without working after 2 years of graduating from training colleges, universities, and the rest. Others are battling with ill health and cannot afford treatment since nurses and midwives are the main brain behind patient care and yet have no health insurance policies covering their health care. If you are a nurse in the ward, you are giving medications, you are taking care of patients, you are making sure that a patient feels at home. And yet, when you have a cut, your dressings, you are supposed to pay for it. When you have a headache, you are supposed to pay for the paracetamol or any kind of painkiller they will give you. And yet, we are the people who are taking care of the sick. We are home, not trained and not practicing. How are we going to use the skills we have acquired in the previous years to help the Ghanaian health system grow? Nonetheless, we are by this press conference again informing the President of Ghana, His Excellency Nana Akufo-Addo Dankwa, that the group of nurses and midwives who completed since 2020 are not yet employed, and therefore we are requesting for him, the President, and the Vice President, His Excellency Dr. Mahamudu Bawumia, Ministry of Health and Ministry of Finance, to immediately release financial clearance and post us to the ward to put into practice the knowledge we acquired through training into use. Thank you.
President, to talk about our employment. We want to be posted immediately within the 72-hour ultimatum we have given. Other than that, we have, just as we said, we have plans to demonstrate nationwide.
Picketing no ye regional police kushia edi Hong Kong for security reasons nti na ye see twesen kakra nti ya twen asan na ye demonstration nationwide no nyame ya adoma say president wie ne statement no ochina na ya ntehwe amfa ye ho a on the 1st of March Tamale wa Kumasi ye be demonstration. Tamale wa Kumasi ye be demonstration on the 1st. And the police for Eddie Honkita Honina every year. The timeline, your Wardema president is up to the end of the month. Because your core ministries, no, at in Sembri. The Bia Yakwa Montrain, ye did Mujuma Montrain, they say, Nim da ye train Amana Kusibu. O my brother, Yansu Yabro. And yes, they be about 20 in the year, yes, sir. Ya, or hey, to abadada. Omo post you, omo post you, say beto aba. Ye juma ho ne hia ye. Nimdeɛ na ye diska ekoto ye no. Ye pese ye di nimdeɛ no eye adwuma. Ye Ghana ha 2022. Ene ye te say Youth Employment Agency. Ene Ministry of Health. Aye collabo. Omo fa ye nuanom omo wie SHS. Na train no omo akọ ward and akọ health facilities na akọye adwuma. Na mpese me bisa se driver ni wo ha ye kofo obi a onim ka atwi e ma no kɔ ekotwi ka na so okotwi ka na ye bisa se ehe na ode passengers na wa form no eko asem we ye sorry tia kan ya asem na ye ka no mpanimfo ante
Muka senche obepost
na nwa yo de ma ye ne se enche bia no ye posting ne nam kwan so eba na nya se bi a omo penipa akọ word nti na omo nso omo initiative a omo de aba